Okay, I think we are now live with George Tamburell and Kevin Romer, who are both EMT firefighters in our community here in the 58th District. And really nice to have both of you gentlemen here joining us to talk about what life is like in your world right now in the coronavirus pandemic and in a lot of challenging times that we're seeing all across the country and here in the 58th District. Welcome, both of you.
Thank you.
Morning.
Can you tell me, George, let's start with you. Why did you go into emergency services?
Well, after I got out of the Army back in the early 90s, a friend of mine, I was working with this person, and he said, well, let's go down and join the local volunteer fire company in Newfield. And, I said, I can't be a volunteer firefighter. I don't own a Carhartt jacket or a flannel shirt. There's no way I can do this. But I went down there, and what an amazing group of people serving their community. I fell in love with it, and I've been doing it ever since. In 2001, I left Newfield and moved up to Cayuga Heights to share a house with some friends who were in the Cayuga Heights Fire Department, and so I ended up at the Cayuga Heights Fire Department. And within a couple of years, serving here and becoming an officer and then the chief officer, and I started working at Bangs in 1998. I took my EMT class and fell in love with the EMS side of it. So I've been working at Bangs as a paramedic since like an EMT in 1998. And then I got my paramedic in 99. And I've been a paramedic at Bangs since 1999. So 22 years now.
That's tremendous. And Kevin, what about you? How long have you been doing this? How'd you get started?
So like most older responders, I fell in love with the TV show Emergency. So I blame them for my career path. In 1982, I became the first paramedic in Tompkins County. In 1989, I was fire chief in Trumansburg. So to answer your question, I've been doing this for about 45 years.
So you were the first paramedic in Tompkins County?
Yes, I was.
What did Tompkins County do before that without any paramedics?
Well, they had EMTs and they had advanced level provider EMTs, but I was the first paramedic, and the area really wasn't set up for paramedics. Medical control orders and stuff like that just weren't available. So I was functioning at a lower level only because the system wasn't ready.
Mm-hmm. Have either of you gone to training over at the Fire Academy in Schuyler County? I don't know if that's something either one of you have done.
I have,
Yes. Yes.
That's a really significant asset that our region has. I mean, folks come from all over the state to participate in training there.
It's absolutely, from my side of things, it's absolutely amazing. We can send, from our fire department, if somebody signs up for a class, they can go over there and take it. It's about $25 to take any class in the book over there, as long as they meet the prerequisites. And it's amazing instruction for a great price. And they go down, they take the classes, they have the meals, they come back, and they put that training into it. So yeah, the Fire Academy is great. We can't wait until the state gets the outreach training in the Fire Academy back up and running, because they really shut down the training program across the state for firefighters, especially in the volunteer service.
Are you waiting for my response? I've been to the Fire Academy. I've done some instruction at the Fire Academy.
He thinks Leslie's frozen.
I believe Leslie's frozen. Leslie is gone. And no sound from.
Okay, can you guys continue talking about your experience right now with how it feels to be an emergency services professional?
Go ahead first, Cap.
Oh, there she is. Okay, I'll go back away.
So my role right currently is still a volunteer provider in Trumansburg, which I'm not doing a lot of, only for I'll call it self-preservation, but I'm a bit on the edgy side of the virus going around. So I isolate myself pretty well. And the same thing at work, I have voluntarily taken myself off of any truck responding. I don't ride an ambulance. I only do dispatching, and I only work from the office. So I have limited contact with people. And because I'm an at-risk adult, I had to do what I had to do to maintain my health as well.
So you did that voluntarily. You decided to remove yourself from participating in the trucks, and
I made it perfectly clear that I was not going to ride an ambulance while this was going on, and
Yeah.
one way or the other, that's the way it was going to be. I hope that day comes to an end at some point before I retire, but I don't know that for a fact.
Mm-hmm. What about you, George? How has your experience been?
So I have two lives here. So the fire department side, as the chief in the fire department, we've put a lot of procedures into place, a lot of safety measures. We still respond on every call that we're dispatched to. All services, all requests for service, EMS and fire. But from the EMS side, we really are focusing on PPE for the members. We limit it to 2 personnel to the rescue truck, where we used to put 3 people in and respond to other vehicles. So there's 2 people per in the rescue truck. Only 1 person makes patient contact unless the situation warrants a higher level of response. And then more people can respond in utility vehicles. Fire side, we really work the same thing. We put people in the apparatus. We just make sure everything's cleaned up when we come home. And all the people are wearing the face masks when they're on the calls. And again, cleaning up, using a lot of hand sanitizer these days. From the ambulance side of things, I really haven't modified my work schedule at all.
You haven't.
Other than we're taking some time, a little extra time off because we just had a baby. But I still work my shifts on the ambulance, and we have the heightened awareness, and a lot of with our dispatch, the 911 center and our dispatchers in house, like Kevin. They ask a specific set of COVID questions. So if we are placed into a higher category, when they dispatch it, they let us know that, there's a higher risk of COVID on this call. Then we up our PPE. So we'll go in definitely with a surgical mask. But if there's a risk for a patient with COVID, we still go in, but we go in with an N95. We go in with glasses. We go in with our gowns on, and we're just more aware of the contact precautions from the ambulance.
And that's for your own safety, like Kevin's pointing out, and it's also for the patient's safety, and it's also, I guess, so that going forward you don't pick up something from one person and then transport it straight to the next person, right? So you've got kind of 3 different groups of people you're thinking about there.
Yes, absolutely. Everything right. We have that heightened awareness. We have that upgraded PPE. We wash our hands and then use hand sanitizer. We, not that we haven't always cleaned our equipment after every call, but we really make the effort to make sure that everything's clean. Spray down the ambulance after suspected, what they call PUI, a person under investigation for the COVID. So we make sure that the next patient getting into the ambulance is not at risk from the previous patient.
But what were you thinking right when this first started? We didn't know how fast this was going to move through our community. I'm thinking back to like March 8th, March 10th, March 15th, as we were starting to see this progression. And then, obviously the new standards came down from the state and the stay in place orders and all of that. How did that feel for you progressing through that period? What were you thinking at that time?
So I had a unique situation. My wife and I were in Florida when it seemed to be moved from the West Coast to the East Coast, when it was moving across the country. We're in Florida, and it didn't appear to be anything going on in Florida. So I sit and watch the news, and in the week that we were there, from the day we got there till the day we got home, I wasn't even sure we were going to come home on an airplane. That's how fast it changed. We didn't give the rental car back until we were for sure that there was a flight coming back. And then we get home to the toilet tissue issue of not being in the store and the store shelves being empty. Like the world had changed immensely in a 1 week time frame for us. And I'm not sure what all happened here because I wasn't here for that week, but I know it just changed a lot in 7 days.
And then when you got back to New York, I think you self-quarantined for a while there, didn't you, Kevin?
Well, we stayed put. I could tell you every place I had been for 3 weeks on one hand.
Yeah.
And generally it was to the grocery store and to
Yeah.
work. Those were the two places I had been.
Well, it's a tremendous responsibility that folks in both of your positions have, because you have this obligation to keep yourselves and your families safe, obviously, as all of us do, but you're also out there on the front lines helping other people who are in challenging circumstances. And so that's a real balancing act that you're both juggling. And I appreciate that. And I'm very grateful to you for all you've done there. What about you, George? How did that experience feel to you?
So it was strange, so we're operating. We had gone to Disney for a week at the beginning of February with the family, with my sister, and we took the kids, and we get back and it was just we were just starting to hear about it. And all of the sudden things escalated rapidly. And, as a parent, I have a 18-year-old daughter who's a senior at the high school. And I have an 8-year-old and a 6-year-old in the Kew Heights Elementary School, and a 3-year-old who is at the community nursery school down at the First Congregational Church. And, all of a sudden we're like, oh, what's about to happen? And are they going to cancel school? How are we going to continue to work? At that point, my wife was, about 8.5 months pregnant and still working, and so all of a sudden we went to the school shutdown, and like, oh man, what do we do with the kids? And my sister-in-law is a nurse manager at Cornell Health, and my brother works for Beacon Skiff, and he's heavily involved in the operations up there. We know what they're doing with their hand sanitizer line, and so they have 2 children, and so we're like, okay, there's no way that we can't share some childcare responsibilities. Luckily, we have a young lady who's been working for us for years, and she stepped up and is now taking care of all 5 of the kids, and so luckily that helped out. And so they were shutting the schools down. How long is school going to be shut down? When Lindsay goes into labor, am I actually going to be allowed to go to the hospital? Or so there were all of these things. It was a very tense couple of weeks trying to figure everything out. But once and I don't want to get political about this at all, but once the steps started going into place from the governor's office and things became a little bit more clear, from the federal side, they were a little bit confusing, but I think that the New York State government did a really good job putting out the word. The health department did an amazing job keeping us updated. And we have a gentleman at work, Bangs Ambulance. His name is Brad Marzoff. He's our IT. He's the supervisor. He's a paramedic on the street. He every single day would put out the updates, the Tompkins County Health Department with their updates and keeping everybody in the loop. And I think that was a very calming time when everybody started doing what they were supposed to do and the right thing. And it was great to see it from the hospital, from the county, from the school district, the PPE rolling in from the state, when all of a sudden you couldn't get N95 masks, the Department of Emergency Response called and said, we're getting a stockpile in. We will definitely move that stuff out. So it was very helpful in that. So there was that tense, week or two in the transition phase, but since then things have really smoothed out. And, it's the new normal, I think, wearing masks everywhere we go, wearing masks on every call. And, it's kind of difficult still, but it's working out.
And I think both of you come from a background. I think, George, did you say you were in the military before?
I was.
And Kevin, you have such a long experience in, various professions where you need to have that diligence, right? And you have to have that following an orderly path in order to deal with an emergency like this. So I appreciate what you're saying, George, that once there began to be a real clear sense from everybody of guidance at the top and here's the next step to take, that certainly makes it easier.
Yeah, absolutely.
And
Agreed.
I also, being a parent myself, I'm very mindful of what you're saying about childcare. It's extraordinary how significant childcare has become to so many families right now. With schools being closed, or at least closed in physical presence, they're still going on teaching the children, but through digital. Yes. It becomes very difficult for a lot of parents to figure out how to juggle everything if they don't have access to childcare. So I appreciate you making that point, George. It's a good one. What can the community do? What can we as community members who aren't involved with the fire departments or aren't EMTs to support folks like you who are out there on the front lines? What do you need from the rest of the community right now to help you do your jobs as well as you can?
So from myself, I'll start with that. A couple of things, be aware that when we come in, we're going to, there's that 15 or 30-second delay when we roll up in a vehicle while we're putting our PPE on. We understand you want us to come in as quickly as possible. And that we will have across the board that heightened sense of awareness and just be patient with us while we're patient with people with medical emergencies. The other thing that I think is very important is that people need to not ignore medical emergencies. If you have chest pain or you're having shortness of breath, don't be scared to go to the hospital. The hospital is very clean. They are, taking all of those steps. Don't let a medical condition that you have get worse because you're afraid of leaving your house.
Yeah.
So from our standpoint, you could help us by making sure that you're taking care of yourself and getting the proper medical treatment. Call your doctor. Your doctor's office is the cleanest place right now ever. And the hospital is the same way. The back of the ambulance is the same way. And everybody's taking those precautions to make sure that the spread is lessened. And when you're out in public, wear your mask. Don't get upset about having to wear a mask. You wear your seatbelt. You get your annual checkups. You do all this stuff to take care of yourself. Wear your mask.
Wear your mask. Yeah. I saw a chart yesterday that just showed that there is a big spike in deaths by heart failure and heart disease over the course of the last 3 months that sort of parallel the spike that we've seen in deaths that are attributed to coronavirus. So I think you make a really good point there, George, that if you're having heart trouble or you're having some other medical emergency, make sure you reach out to your medical responders in normal times, because probably that's one of the cleanest places you're going to end up anyway, because you folks are taking real precautions. What about you, Kevin? What do you think the community members can do? You have any thoughts to share there?
I'm going to just echo George that the hospital, the ambulance, the people are the cleanest that they've ever been. People also have to understand that only one person is going to go in with the patient. That it used to
only
be
one visitor along with the patient.
One visitor. Everybody else stays outside. And that's a tough one for people to understand. But it's interesting you brought up the heart related issues. All too often, people sit back and say, and I am guilty of this, by the way. This is voice of experience. It's nothing. It'll wait. Not a big deal. It'll go away. Don't wait. Don't let it go away. Get your problems taken care of. If you feel like you need an ambulance, call an ambulance. It's not that big of an issue to deal with. We're here to help. We're certainly not here to hinder. And if George couldn't say it any louder, wear your mask outside when you're within 6 foot of people. You don't need to wear gloves around while you're traveling. There's no reason for it. It actually makes the situation worse. And just I don't want to say just relax, but just relax. We're all getting through this. We're all in this same, we're all living the same life. And I know that that's really hard thing to say because we're not all living the same life. I understand that too, but we're all there together. I believe Leslie left us again.
But that's, I mean, I'll kick right in if we're still live, to echo what Kevin just said. Don't wear your gloves around. Just wash your hands. Every store has hand sanitizer. When you go in, use the hand sanitizer. When you come out, use the hand sanitizer. You know, that's the best thing that you can do. Wash your hands, keep yourself, keep yourself safe, and others will stay safe by your good practices.
That is a fantastic point, George. I think we can wrap it up now. Did you guys have any last remarks you wanted to make while we're still alive? Oh, there's Leslie.
I really apologize. We seem to be having some sort of internet difficulties. That's another one of my concerns, of course, is that, the internet is patchy here in upstate rural New York where we live, and it tends to go in and out. And I apologize for keep kicking out here. But I do appreciate it. And Madison, thanks for jumping in for me. Any other thoughts that you two would like to share? I'm really mindful of what you've both said, that we need to wear our masks, we need to follow instructions, be safe. That both of you come from professional backgrounds where you really understand the value of following rules that are set by people who maybe know more about this than we do. I trust that you know quite a bit more about this than I do. So I'm happy to follow your advice. Any other thoughts you might like to share there?
I'm
sorry, go ahead, Kevin.
I'm jumping in first.
You go.
Please.
My final is masks in general. Masks are designed to cover your mouth and your nose.
You don't wear them on the bottom of your chin, right?
I try not to.
Yeah.
COVID is still about us, even though the world has changed once again in a week's time. COVID is still about us. When we're out doing our peaceful protests, make sure if you're within 6 feet of one another, make sure your masks are in place. Nothing has changed as far as COVID's related. Yeah, the curve is flattening. We've done a really good job, but it's still there. Don't let the world's events take away from that.
Very, very good point there, Kevin. George, any thoughts?
Yeah, my final thought, I think, is take care of yourself. Your mental health in this trying time. I know I get very stressed out working with the kids through their schoolwork. It seems like everybody's got a meeting at a different time, and parents are trying to work from home or trying to piece together a work schedule. Take care of yourself. Exercise. Spend some time sitting on the couch with the kids reading. And in our household, I know if the schoolwork gets too stressful, we just go outside and throw the baseball around, or go for a walk, or one of us works out, or we just let the kids be kids. Eventually everybody will be back at school and it'll be over. This is tough right now. School's over on the 16th. Take care of yourselves. That's a big one. So.
I think that's a really good point, George. And I think if we all give ourselves a little bit of a break, we're going to be able to go out into the world and take care of each other a little bit better too. So I appreciate that very much. And George, huge congratulations to you and your family on your new baby.
Thank you.
That's tremendous to have a new baby born into our pandemic times. That child's going to grow up very resilient.
Yes.
Remember your family. Yeah.
Yes. Thank you.
Thank you both very much for joining me. And I'm really glad to have both of you here. Our local EMTs and firefighters and emergency services personnel are so vital to us right now. I appreciate you sharing your experience and sharing your thoughts.
Thanks, Leslie.
Thanks for having us.